Hi everyone, this is Dr. Olivia. Today we're going to be talking about what's called the active cycle of breathing techniques, which is a set of exercises that'll help to remove phlegm from the airways. This is important especially nowadays with the respiratory illnesses going around and those who may already have lung problems to begin with, as it can be helpful to remove any of that buildup of mucus or phlegm that gets stuck in the bronchial airways or the lungs that make it difficult to breathe during daily activities. It's important to remove this phlegm to breathe more easily, prevent chest infections, and reduce bouts of coughing. This is a diagram of the active cycle of breathing technique. First, you start off with breathing control or relaxed breaths, followed by deep breaths, breathing control again, deep breaths one more time, and breathing control for a third time, followed by the final step, which is huffing or coughing if needed. We will go over each of these steps individually. Breath control and relaxed breaths is when you breathe in and out gently, preferably through your nose, but if you're going to use your mouth, you want to use a pursed lip breathing technique, which gives you the sensation of blowing the light of a candle so that it flickers but doesn't blow out. You want to let go all the tension in your body and fully relax, and you can close your eyes if needed as well. You want to gradually make these breaths longer with each breath. Relaxed breaths can also help outside this technique at any point during the day if you're feeling short of breath, fearful, anxious, or panicked. This can happen often after doing high aerobic activity, any kind of walking or strenuous activity, or even during balance or fearful activities in upright positions. For relaxed breaths, you're going to breathe gently in and out through your nose with relaxed posture. But if you're going to use your mouth, you're going to use pursed lip breathing, which looks like this. Lightly flickering the light of a candle. When doing this stage, I do about 2 to 3 relaxed breaths, or you can do it for about 20 seconds, whichever feels best for you. The second stage is deep breathing. What this is diaphragmatic breaths, which I will show in the next slide. What they are long, slow, deep breaths, preferably through your nose with a relaxed chest and shoulder. When you get to the top of your breath, you can hold for 2 to 3 seconds before releasing your breath. Try it with holding your breath at the top and without holding your breath at the top and see which one you like best. For deep breaths, we're going to do diaphragmatic breathing. Diaphragmatic breathing comes from your diaphragm low into where the belly is going to move out and back, wanting to keep the chest and shoulders relaxed. You can do this again with a wall behind you or with a chair behind you. I'm going to show you from the side so you can see my belly move out and back. One hand on the chest, one hand on the belly helps to see the movement. So you're going to breathe low, deep, and slow in. I would take about 3 deep breaths. I recommend holding for about 2 to 3 seconds, but try it. If it seems difficult, just go to the deep breath to the top and let it out. The next stage to know is huffing. Huffing is when you exhale through an open mouth and throat, but you're not coughing. It's like when you're trying to fog up the mirror in the bathroom or on your glasses. You're going to use your abdominals, but you don't want to huff too hard that you feel like you're wheezing or tightening your chest. This stage is used to help move phlegm up higher into your bronchioles to be removed in a controlled manner. There are 2 different types of huffs that I will show you. One is a small, long huff, which moves phlegm from low into your chest. It's a small, medium breath in, and then you move the air out until your lungs feel basically empty. There's also a big, short huff. This is going to move phlegm from high into the chest, and when you're ready to have it come out, but not before. It's used to clear phlegm without coughing. You take a deep breath in and a quick air out. For the 2 types of huffs, there's the small, long huff, which is going to be small, medium air in, with letting it out until you're out of breath. So it's going to look like this. For the big, short huff, it's going to be a deep breath in and a quick air out, like you're fogging that mirror. So it's going to be You can do the huffing between 1 to 2 times. When doing huffing, be careful. If wheezing is heard, you are huffing too hard or for too long. Always make sure to do breath control after each 2 huffs. If you're having trouble keeping your mouth and throat open when you huff, try using a small tube when practicing, like a tape tube, and gently close your lips over the tube when you're breathing. If huffing allows the clearing of the phlegm, then do not cough. But if it doesn't, you may need to, but only if it can be cleared easily. You want to avoid long bouts of coughing, as it will make you tired, breathless, and have a sore throat and chest. Do this as often as you need to keep your chest clear. If you are feeling well, only 1 to 2 times a day. But if you have more phlegm or are unwell, then shorter or more frequent sessions may be better. Try to do it when it's easiest for you, or if you feel there's a buildup in your lungs. It's best to try and fit it around your daily routine to make it part of your regular schedule. Try to avoid doing it straight after a meal. For position, you want to depend that on your medical condition and also talking to your physical therapist or doctor, who may be suggesting a postural drainage position. But you can do this in sitting. Just make sure that you are comfortable, well supported, and relaxed.